You know, so many women that come to me think that pads or diapers are treatment. They aren't treatment. This is just a way to manage the incontinence. A necessary way to manage the incontinence, but it's not treatment. The way that we treat incontinence in most cases is by strengthening the pelvic floor. That's the group of muscles that support the bladder, support the vagina, and support the rectum. Now, everyone's heard of Kegels, of course, those exercises where you tighten those muscles and then release them. The problem with Kegels is while theoretically they work, most women don't do them correctly and they don't do them consistently, which is why so many women continue to leak even if they do their Kegels. I really rely on pelvic floor physical therapists as well, who will facilitate strengthening those muscles and relaxing those muscles. But an at-home device such as a Tane facilitates the work of the pelvic floor physical therapist so that you can continue what you've learned in their office at home. And let's face it, a lot of women don't have access to a pelvic floor physical therapist. They can't afford it, their insurance doesn't cover it, or they're just not comfortable with it. Now, a lot of women also hear about pills and surgery. Pills is never used for stress incontinence, but there are medications that can be helpful with urgent incontinence, but like any other medication, there can sometimes be side effects. So as a physician, we always prefer to avoid that since this will be a lifelong treatment. Surgery is also sometimes recommended, particularly for stress incontinence, but that would be a last resort, not a first resort, and only if someone fails the different ways that we have to strengthen the pelvic floor.